Okay, so as you've heard around the room, we have a diverse group of attendees from academia, professional organizations, and industry. This workshop is a collaboration between the Eunice Kennedy Shriver National Institute of Child Health and Human Development and the National Human Genome Research Institute. Our goal here is really to explore the synergistic genomic research opportunities for our institutes. So in this brief presentation, I will go over the framework of today's workshop, objectives, and a few logistics. Okay. In the spirit of having a joint workshop, the three topics we'd like to cover are reproductive, prenatal, and neonatal health through a genomics lens. Reproductive genomics captures the before pregnancy phase, but could also include fertility and infertility. Prenatal genomics covers the during pregnancy phase, and neonatal genomics encompasses the after pregnancy or newborn phase. So when we're looking at these three scientific areas through a genomics lens, the three cross-cutting themes are technology implementation. Do we have the technology ready today across these three scientific areas? Ethical, legal, and social implications. Should we be doing this? And implementation of genomics in healthcare. How should we implement genomics in a clinical healthcare setting? We think these are important scientific areas and recognize that not all fields embrace the genomic medicine aspects, but we wanted to survey the field. Okay. To further expand on the can we do it, should we do it, and how do we implement it, the objectives of this workshop are: what current genomic technologies are ready for implementation? What are the ethical, social, and legal implications for genomic medicine implementation? And what are the challenges to implementing genomic medicine for each of these scientific areas of reproductive, prenatal, and neonatal health? So I'll revisit these questions in a little bit more detail later this afternoon before we go out into the breakout sessions. Okay. Now I would like to highlight just a few logistics for the next 2 days. So this morning we'll start out with 6 scientific presentations, followed by a working lunch during the breakout sessions. If you ordered box lunches from Potbelly, the lunches can be picked up outside this room on the island. The other option is there's a cafe about a few doors down here, and Valentine Nera, our Palladian partner contractor, will be able to direct you to the cafe. So you'll find in your meeting packet your assigned breakout sessions and room assignments. WebEx is available for all the breakout sessions. For those listening on the WebEx, if you could please enter your questions into the chat box. If you could address it to either Ellen Howerton or Sarah Gould, we will read your questions out loud to the rest of the group. So after the breakout sessions, we will come back to this room for breakout reports, and then we'll end the day with a brief summary and next steps. Day 2 is similar to day 1, except that we'll start out with the breakout sessions followed by breakout reports. Lunch instead will be in this room. Again, box lunches from Potbelly will be located outside this room. And then we'll wrap up the day with summary, next steps, and closing remarks. So I do have one item to bring to your attention, and that is we will be video recording but not live casting this workshop. We recognize that sensitive topics and conversations might come up, and while we don't want to inhibit discourse, please be aware that videos will be made available to the public. Okay. With that, I'd like to thank my colleagues at NICHD, NHGRI, and our contractor Palladian Partners. And in particular, I'd like to thank Anastasia Weiss, Melissa Parisi, Tuba Fair, and our program analysts from NHGRI, Sarah Gould and Ellen Howerton, and of course the entire working group who helped plan this workshop. I'd also like to thank our IT folks from NICHD and NHGRI for putting together the AV equipment. This is NICHD's conference room, so thank you for letting us use this space. I think we have a few minutes left, so I can take any questions. Okay. With that, I'd like to now introduce Diana Bianchi, Institute Director for the Eunice Kennedy Shriver National Institute of Child Health and Human Development, and Eric Green, Institute Director for the National Human Genome Research Institute, for a brief welcome and history of collaboration. Thank you.